into it. So today I'll be talking about cough, and I'll be talking about cough from the point of experience because I've had cough before. I remember during my PhD program, I had terrible cough that almost got me destabilized, but I thank God I was able to overcome it. So I'll be talking about cough from the point of experience. So what is really cough? Cough ordinarily should be a natural thing, and of course, is a natural thing. Is the body's way of expelling unwanted materials from the system. The body's intelligent way, body's innate way of pushing out unwanted materials from the body. So that sudden, forceful burst of air that comes out through your mouth and sometimes through your nose to push out unwanted material, from the system. Unwanted material could be mucus, could be bacteria, could be irritant, from your system is what we call cough, right? So before you were sick, you were healthy, or before sickness, you were healthy. So what do you think could result in that unwanted materials in your system, right? Now, so this will lead us to what we call cough orthodoxy. Cough orthodoxy. So we're talking about causes of cough. From the systems level view, every disease originates from two sources. We talk about nutritional dysfunction and then toxicity buildup. So cough could come from, whether you are low on nutrients or maybe you've nutrition in your system, or there is a buildup of toxins in your system, which could come from biological particles and then anthropogenic toxicants. These two things, nutritional dysfunction and toxin buildup, they are the root, you know, causes of cough, essentially. And I'll walk you through it. So you know that the epithelia, or rather the airways, right, the respiratory tract, essentially is lined by what we call epithelial cells. These epithelial cells, they are protective in nature, and what they do essentially, like I said, is to protect the airway. Now, obstruction can happen in the airway, central to the epithelial cells erosion. Obstructions of the epithelial cell can essentially result in you having difficulties that will lead the body to force, the unwanted material through the airway outside of the body. Now, this obstruction could come from nutritional dysfunction. Like I said, maybe if you are low on vitamin A, low on vitamin D3, low on antioxidants, they can cause, an erosion of the epithelial cells. And once the epithelial cells are eroded, they become highly thin, highly prone, to, irritant. They become highly, sensitive to little things. So upon, upon any obstruction there, they tend to overreact to make you have that sudden, burst of air to push out something. So erosion of the epithelial cell central to deficiency of vitamin A and vitamin D3 antioxidant can make you to cough. And then you talk about toxicity buildup, right? So this case, we are talking about biological particles or what? Anthropogenic toxicant. So when you look at the biological particle aspect, your cough could be as a result of microorganisms. You talk about bacteria, talk about fungi, talk about viruses, even parasites too can cause cough. Now, if you look at it from our virology class, we mentioned rhinovirus. Rhinoviruses could cause cough. In fact, they are the commonest, cause of cough. Rhinovirus. We talk about influenza viruses. We talk about adenoviruses. We talk about coronaviruses. They can, cause cough. That's about the aspect of viruses. What about bacteria? Of course, our mind will go straight to Streptococcus pneumoniae, as one of the commonest causes of cough. We talk about Bordetella pertussis, which is the causative agent of whooping cough. We talk about atypical bacteria, essentially. Mycoplasma, chlamydia, they all cause pneumonia, your Mycobacterium tuberculosis, which is the causative agent of pulmonary tuberculosis. They are all biological particles, essentially bacteria that can cause cough. Then we jump into parasites. Ascaris lumbricoides can actually cause cough. Nicator americano and Xylostoma duodenum, they can cause cough. Uh, Paragonymous, species can cause cough. That's about the parasites. And then we talk about the fungi, fungi that can cause cough. You talk about coccidioides, aspergillus species, histoplasma capsulatum. They are all causative agents, of course. They can cause cough. So these are the biological aspect, right? So when you talk about the anthropogenic toxicant, here we talk about particles from the environment, man-made particles that can result to cough, like the irritant, like the smoke, like chemicals, cadmium, mercury. When you inhale this thing for a very long time, they can cause irritation of your airways, which can result to cough. Now, beyond that, now we've talked about two cardinalities as being central to what? Cough, or what we call the cough orthodoxy, nutritional dysfunction, and then toxicity buildup. You know that when you are low on nutrient, or when there is your body is overwhelmed with these toxins, your immune system will go down. So dysregulation of your immune system can actually result to what? Cough. Of course, it's all from nutrients and then the toxin buildup. So when you have a dysregulation of the immune system, it can cause acid, reflux. It can cause acid reflux, which can cause irritation in your airway, resulting to cough. Now, so these are some of the causes of cough, right? That being said, let's jump right into the treatment of cough. Now, in the hospital setting, essentially, we look at cough from two perspectives, either productive or non-productive cough, right? A cough is productive when you are at least producing a phlegm or mucus, and it is non-productive when there is no mucus or phlegm production, especially you have sensations and, itchiness around your throat and all that. So it is non-productive when you don't have mucus or phlegm production. So if we are treating cough that is productive, essentially we use expectorants, we use mucolytic. Mucolytic and expectorant, they go together. And what they do, because the body is trying to expel unwanted material from the system, some of these mucus or phlegm can be very sticky. So the mucolytic and expectorant, what they do is to soften the consistencies of the cough so that it can easily be coughed out, right? So we have examples of expectorant can be ammonium chlorides. We talk about guaifenesin, they are examples of what? Expectorant. And then when we talk about mucolytic, that actually breaks down the mucus, make it easy for the body to expel. We give example like carbocysteine, we talk about methyl we talk about bromhexine, we talk about Donase Alpha. They are all examples of mucolytic, right? These names I am mentioning, you may not really see them written boldly on your cough syrup. It is under the composition, of this thing, this cough syrup, that you see them. So anytime you see these names I have mentioned, you know that they are either mucolytic or expectorant, as the case may be. Of course, the aspect of the non-productive cough, which comes with a lot of itchiness and irritation, what we do is to give cough suppressants, right? So cough suppressants can be opioid suppressants or non-opioid suppressants. Now, when we talk about opioid suppressants, we are referring to constituent like codeine, constituent like dextromethorphan, constituent like farcodeine. These are opioid what? Cough suppressants. And then when we talk about non-opioid cough suppressants, we are referring to antihistamine, essentially. First generation antihistamine, second generation antihistamine. And most times I advocate, I encourage people to go for first generation antihistamine because they come with low adverse effects. Common example can be loratadine or cetirizine. They are very effective in what? Uh, in suppressing cough, especially, yes, in suppressing cough, especially dry cough. Of course, we equally consider your nasal congestion. Sometimes your nasal cavity can be highly congested that we recommend nasal decongestants. Here we use the ephedrine, we use oxymetallazine, we use xylometallazine, we use pseudoephedrine, and a whole lot of that. They are all nasal decongestants. So from that pharmaceutical angle of treatment, these are some of the areas we mentioned. Remember, what I am saying is purely on empirical basis. For proper treatment of cough, it is recommended that you go for laboratory analysis to see that what is really wrong with you, to actually get to the root cause of what is wrong with you, to know whether it is from any of these biological particle origin. No, if it is from bacteria, virus, whatever as the case may be, it will be appropriately identified, and then the treatment will be tailored. So again, we do give antibiotics along with this suppressant and expectorant or mucolytic most times when we are treating empirically. Yeah, we are saying empirically because a test has not been done to actually get to the root cause of it. So most times you walk into the pharmacy or hospital, we give you expectorant mucolytic or suppressant or nasal decongestant along with antibiotics. We use Septrin, we use azithromycin in combination with this thing to actually deal with your cough. But like I said, my discussion is from the systems level view. And I told you that depletion of these epithelial cells can lead to what? Increased sensitivity of that area. And in that regards, what we do is how do we increase or improve the integrity of the epithelial cells? So we go on vitamin A, we go on vitamin D3 because they actually increase the integrity of the epithelial cells. So anytime you have prolonged cough beyond the expectorant mucolytic, suppressant, and then nasal decongestant and antibiotics, it is equally high yield that you go for vitamins, essentially vitamin A, vitamin D3, because they help in maintaining the integrity of the epithelial cells. Remember, vitamin A actually forms a scaffold of your epithelial cells, and then the vitamin D3, produces what we call CAM, cathelicidin antimicrobial peptides. They are antimicrobial in nature. So once you have an optimum, once your epithelial cell is strong, once the integrity is high, they can actually kill any organism that may come there. So that being said, what other thing do you want me to talk about? I've talked about cough, what it means. I've talked about causes of cough from both the systems level view and then the common way we describe cough. We talked about types of cough. We talked about treatment of cough. I think that is it. If you want me to talk about cough from any other angle, you can leave it in the comment section, and I see how I deal with it. Right? Thank you.